Hey everybody. So I serve a highly diverse group of people in my practice. And once I heard a woman ask a man while in the reception area, how in the world did you end up with that disease? I mean, you can tell the man was shocked and did not answer right away, right? And so she continued and said, how did that happen to you? The man remained speechless. And he finally replied and said, God knows. You can tell that the man certainly felt ashamed, as if he had done something wrong or something. So of course, I had to step in, and after addressing the HIPAA violations in the room, I was able to mediate the conversation. And after a while, the woman started apologizing to the man. Apologized for making him feel bad. But even more remarkably, during the conversation, I encouraged the woman to think about why is it that her community does not have people with that particular disease, right? What is it about her community or neighborhood, for instance, that makes it so special or protected from these diseases? This is when it hit her. How health and healthcare disparities is influenced greatly by the structural inequalities that already exist. You see, I immediately thought to myself that was a success for her to at least acknowledge the differences that exist between communities and also that is beyond the man's own control. But to be honest, the question still remains. Why are some people prone to specific diseases while others are not? This is how we start to understand, right, the impact of these structural and systemic inequalities that exist. As a physician, I am led to this question often, especially when I look for the causes of all of the pathologies I see, or better yet, what led up to the condition that I'm treating. I always land on the areas that are outside my domain, like it's outside of healthcare. That is right. I usually end up discussing the problems around, let's say, housing inequalities, problems around education inequalities, and of course the big one, the economic inequalities. See, due to the fact that it is such a long list of issues, that medicine decided to call it social determinants of health. That's right, social. Now really, right? That is not inspiring to me when you call it social. It's almost like we in medicine are dismissing it by calling it like social, so that it means we have nothing to do with it. And it's outside of the scientific realm, outside of our domain, and it does not impact us, right? So it's not medicine, and so because it's social. Wrong. That certainly won't last if you're practicing in my community. Like whatever they want to call it. But for me, every day I deal with these social pathologies that impact my patients. Whenever I find evidence of unequal treatment of patients, I prescribe them, for instance, a concoction called feeling privilege. That is right. My patients would be able then to stop any physician in their track to get answers to their most pressing questions about their health. Or when they say they cannot afford their medication, I then prescribe medical tourism or coupons or what insurance or pharmaceutical companies call patient assistance programs as a way to get the medication covered. And when they tell me that they have no other options for their condition due to not having money, I work with my team to identify available community resources or even grants as soon as possible to avoid any delays in their care. We never stop at no. Not here, we don't. When my patients tell me they have asbestos lungs from the building they are living in, for instance, I write letters to landlords telling them to get their act together. When they come with obesity due to lack of, let's say, fresh food around their neighborhood, or what I do then, I prescribe where's the next farmer's market, right? When is they coming to town? Or if they don't have safe parks or neighborhoods to walk in, I notify their local police department to see what programs in their academic league that they have that they're putting together. That is right. I get involved. I get my hands dirty. I do the work with the community in order to treat these social pathologies. As an internal medicine physician in this community, it is my duties to help the body treat itself, but also I advocate for patients when they cannot advocate for themselves. You know what that means? That means I treat all pathologies, including the social ones. Look, I'm the best health advocate my patients have, so that is what I have to do. although I'm addressing these social determinants of health and health disparities, that they cause, I hope to influence you as my listener to do the same. Because clearly, my efforts alone is not going to be suffice to solving that ultimate problem of what we see as health and healthcare disparities that currently exist in our communities. Anyhow, I'm Dr. Coupet. I'm the people's doctor. Thanks for listening, guys. See you soon.